Rheumatoid arthritis is a heterogeneous disease that is difficult to manage. If inadequately treated, up to 60% of RA patients may become disabled within 10 years. An early diagnosis and effective treatment is critical in properly managing patients with RA. What may be happening in rheumatology offices that could be getting in the way of early diagnosis and optimal treatment? Maybe patients aren't always communicating their symptoms. Or perhaps there is discordance between provider assessment and patient assessment of their disease. Additionally, current tools used most frequently in assessing RA may miss underlying subclinical inflammation. Even when clinical symptoms appear under control, joint damage can still occur. A recent study showed that of patients in clinician-defined remission, 1 in 5 had radiographic joint damage over the next 12 months. Improved outcomes are possible with a comprehensive approach. Vectra is an advanced blood test measuring 12 biomarkers and providing molecular insights to help inform your medical management decisions. Vectra measures multiple key pathways of rheumatoid arthritis, providing an objective, more comprehensive measure of RA inflammation than a single biomarker. Vectra is unsurpassed in its ability to predict radiographic progression. Vectra was recently adjusted to account for the patient's age, gender, and adiposity, providing a more personalized score, represented on a scale of 1 to 100. The Vectra score is categorized into low, moderate, or high disease activity and inflammation. Patients in the high and moderate categories are considered to have uncontrolled inflammation. Vectra has shown its ability to track response to multiple therapies, making it a useful tool to help guide medical management decisions when used over time. Ensure success of controlling RA inflammation by using Vectra at the initial visit, in changes with drug therapy, and to monitor response to therapy. Changes of 8 units or more in patients with high and moderate Vectra scores represent a meaningful change in RA inflammation. An increase in score by 8 or more units indicates an increasing level of inflammation and may indicate a need to change the patient's treatment. A decrease in score by 8 or more units indicates a decrease in disease activity, indicating that current treatment is working. Adding a molecular assessment to the patient and physician assessments gives you a more complete picture of the patient's RA. Patients will have a better understanding of their disease and how their treatment is working. Together, all 3 assessments guide patients and providers with treat-to-target strategies to help meet their goals.